Welcome everyone to the Statewide Medicaid Managed Care Managed Medical Assistance Program webinar for Managed Medical Assistance Potential Network Providers. This presentation will teach you about transitioning to Managed Medical Assistance, selecting an MMA plan, and continuing your services in the Statewide Medicaid Managed Care Program. To access today's presentation, please visit the link below, asa.myflorida.com/SMMC, and select the News and Events tab under the header image. Note, you can also to sign up for SMMC program updates via email. Next, please select Event and Training Materials to download the slides from today's presentation. You may also view details regarding future SMMC events by selecting Calendar of Events and Training. Last, choose the files you would like to save. Another note, you may also view files from past events and ACA guidance statements or submit questions to be answered in future presentations. Now that everyone has had a chance to download today's presentation, let me introduce today's presenter. We have Melanie Brown-Wolfter with the Agency for Healthcare Administration. I will now hand you over to Melanie.
Good afternoon, everyone, and thank you very much for joining us today. We'll go ahead and get started. First, we'd like to talk about the agency goals for a successful rollout. And there are two things that are really, really important to the agency during this rollout. And one is that we preserve continuity of care so that recipients will continue to receive the services that they need. And secondly, that plans have the ability to pay providers fully and promptly. And so to that end, we are working on a transition plan that allows the recipients to continue to receive their care. And we have created a centralized complaint system so that if there are any issues, they can be resolved promptly. So again, we want recipients to be able to keep their primary care provider. We want them to keep their current prescriptions, and that we want to know that ongoing courses of treatment will go uninterrupted. And these are things like chemotherapy and radiation. And again, we want plans to be able to pay providers fully and promptly and to ensure that there's no provider cash flow or payroll issues. Additionally, we want to make sure that the plans have a sufficient and accurate provider network under contract and that these providers are actively taking patients. And this will allow for an informed choice of providers for recipients and the ability for recipients to be seen and receive care. We also want to know that the Choice Counseling call center and website must be able to handle the call volume of recipients that are engaged in plan choice at any one time. And to that end, we are looking at doing the regional rollout so that we can ensure success. And first, we're going to talk about the Choice Counseling process and how recipients will make a plan choice under MMA. And Choice Counseling is a service that's offered by the Agency for Healthcare Administration through a contracted enrollment broker, and the enrollment broker assists recipients to understand managed care, to understand the available plan choices in their region and the differences in the plans, and understand the enrollment and plan change process. Now, it's important to understand that Choice Counseling is unbiased and objective, that the Choice Counselors do not tell recipients which plans to choose. They do not make plan selections for recipients, but they do provide unbiased information that allows the recipient to make an informed choice. Choice counseling can be triggered by many factors, two of which is that a recipient is determined to be newly eligible for managed care and is mandatorily required or may voluntarily choose a managed care plan, or if a current plan enrollee desires to change from one plan to another, then the choice counseling process will be activated. This is a pictorial, and we'll start looking at the slide as if it's the face of a clock at 12 o'clock. A recipient is determined to be eligible for enrollment or enters the annual open enrollment period. And then moving to the right, the recipient will receive communication informing him or her of the plan choices that are available. Now, this communication is in writing and it's sent through the mail, so it is very important that all recipients have the most updated address information available. So we encourage you as providers, as you're seeing patients or clients, to make sure that their address that is in our FEMA system is the most updated information available. Moving down towards the bottom of the page, recipients may enroll or change plans using the telephone, going online, or in person with a face-to-face interview with Choice Counseling. And then the enrollment change is processed during the monthly enrollment processing and becomes effective the following month. And the agency actually processes enrollment only one time a month. And so if you make a plan selection, say in May, you just make a plan choice on May 5th, that choice will actually be effective on June 1st because it's got to go through the monthly enrollment cycle before it can be seen in our system. Now, after you've selected a plan, new eligible recipients are allowed to try the plan out for 90 days, which means they can see if they like the plan, if they like the providers in the plan, if the plan is going to meet their needs. If they don't like the plan or want to choose another one, within that 90-day period, all they have to do is contact Choice Counseling and the choice can be made. Again, so how can recipients choose a plan? They can go online at the website that's at the top of your page, or they can call the toll-free number, 877-711-3662, and they can speak with a choice counselor. We also have an automated option, so they can use the interactive voice response system, or it's called IVR. So if recipients know which plan that they want, they can opt for the IVR system. It takes about 2 minutes online, and they can select the plan of their choice, and then that choice will be processed in the monthly processing cycle. Please know if you do use the IVR, you'll have to have the PIN number, PIN number, and that is included on the welcome letter, and there'll be a slide later in the presentation that will show you where to look for that. And, of course, you have to know the plan that you want. Now, choice counselors are also available to assist recipients in selecting a plan that best meets their needs. And we can do this over the phone, and recipients that have special needs can request a face-to-face meeting, and choice counselors can meet them at a provider's office, at a public library, or in their home if they choose. Recipients who are required to enroll in MMA will have 90 days after joining a plan to choose a different plan. And so this is the 90-day opt-out period that they don't need a good cause reason. They can just change plans for any reason that they want. After 90 days, recipients who are required to enroll will be locked in and cannot change plans without a state-approved good cause reason or until the annual open enrollment period. Now we're going to talk about the actual choice counseling cycle and what written information is sent to our recipients. The first thing that goes out is a welcome letter. And so 60 days before the plan begin date, recipients will receive a letter and a packet of information that talks about their choice of plans and how to choose a plan. And in that packet will be the welcome letter with the PIN number on it, a brochure that provides plan information specific to the recipient's region, where they are by geography, information on how to make a plan choice, and the plan to which they'll be assigned if they don't make a choice. We then send a reminder letter, and this goes out 30 days before the enrollment is effective, and it reminds the eligible recipients of their need to make an enrollment choice by a specific date. And the cutoff date, or the date that they have to make a choice, was included in the welcome letter as well. And this just says, we haven't heard from you, we're encouraging you to make a choice, please call and let us know. Now we send a confirmation letter after a voluntary plan choice or a plan change that confirms the recipient's selection. So if you call Choice Counseling, you'll receive a confirmation letter. If you use the IVR process, you'll receive a confirmation letter. If you go online and make a choice, you'll receive a confirmation letter. This lets you know the information that's in our system, and if that information is not correct or you want to make another plan choice, then you contact the Choice Counseling Center. Now we have an annual open enrollment period, and information is mailed 60 days prior to the recipient's plan enrollment anniversary date to remind them of the right to change plans. Now, with our MMA rollout and implementation, as we roll out by region, the recipient's open enrollment period will reset to this MMA period. So for recipients that are in regions 2, 3, and 4, for example, their annual open enrollment date will be May 1st. So May 1st of 2015 will be their open enrollment period. This will not reset the Medicaid eligibility redetermination date. That is a separate date than open enrollment. But everyone who enrolls in MMA will have their open enrollment period reset to the time period when they rolled in, between May and August of each year. Now here's our rollout schedule. For those of you who haven't seen this information, we're going to roll out regions 2, 3, and 4, which basically are Panama City, Tallahassee, Gainesville, and over to Jacksonville and down to Volusia County. And that's going to happen on May 1st. And we're going to roll out all of our standard plans, plus our HIV, AIDS, and child welfare specialty plans. And then regions 5, 6, and 8, which are the Tampa-St. Pete area and down to Sarasota and Collier County. And that will happen on June 1st. And again, we're going to roll out all of our standard plans, plus our HIV, AIDS, and child welfare specialty plans. Then moving forward on July 1st, we're going to roll out regions 10 and 11, which are Broward and Dade and Monroe counties. And we're going to roll out all the special standard plans, the HIV, AIDS, child welfare, and the serious mental illness specialty plans that will be available in July. And then the final rollout will happen August 1st. We will roll in regions 1, 7, and 9, which are the Pensacola area, the Orlando area, and then West Palm Beach. And we're going to roll out our standard plans and our HIV, AIDS, and child welfare specialty plans. Now, also, on August 1st, we're going to roll out the Children's Medical Services Network MMA plan. So all children who are currently in the CMS network will transition to the MMA CMS network plan. And that will happen statewide on August the 1st. This lets you know what county that you're in or what region that you're in so that you can see by geography the actual regions that you're in. These regions correspond to the current Medicaid areas, and so they're just going to be called regions under the Statewide Medicaid Managed Care program. This is a very busy slide, but we want to show you and share with you when the notifications and enrollment dates will be effective. And so we'll walk through Region 2 as an example. So if you look at the first column, Region 2, and then you look at the third row and go across from left to right, you'll see that we sent a pre-welcome letter on the week of January 2nd that said, Statewide Medicaid Managed Care is coming to your area. Please look for additional information in the mail. And then the week of February 17th, we sent the welcome letter with the entire packet. It has the welcome letter, it had the plan brochures, it had information on how to contact Choice Counseling, it had information on the plans that are available in each area. And then we're sending a reminder letter this week of March 24th to say to the folks that we've not heard from. And then the last day to make a plan choice before the initial enrollment date is April 17th. And then the following week, we'll have our enrollment process cycle, and then the enrollments will be effective on May 1st. And for recipients who are required to enroll, they'll have 90 days after May 1st to choose another plan without cause if they want. Now, when you go online to our Choice Counseling website, this is the landing page, so this is the first thing you see. The information is available in both English, Spanish, and Creole. So you can choose the language that you would like to make your plan choice in and receive information. One of the next pages is information that's available or things that recipients should consider when they choose an MMA plan. So if you look at the top bar, it has a 1, 2, 3, and 4. The first one is how to choose a plan, and this is the information that's there. Tab number 2 has plan information specific to the region, so that you can see what expanded benefits or provider networks or that sort of thing that's available. Tab number 3 is specialty plan information, which lets you know the specialty plans that are available in your area for folks who are living with particular chronic conditions. And then tab 4 is the actual enrollment, where you'll go online to make a plan choice and select a plan. And then we also have a glossary with different terms that are used and a frequently asked questions tab in case that there are questions that you may have, and the information will be readily available to you. Now, when you go to log on, you can do it either by using the PIN number, which is going to be on the letter, on the welcome letter that's sent to you. And so you put in the PIN number, and then you'll be able to log in. But if you can't find the welcome letter or you can't remember your PIN number, if you look at the very bottom left-hand corner, it says log in without using a PIN. And so if you select that link, you will still need to have your Medicaid ID number and name, but you'll be able to log in without the PIN number. Now, this is the letter that I've been speaking about. If you see the top where the red circle is, that's the security PIN number. It's a 4-digit number that's available to recipients that are on the welcome letter that goes out. The other information there is about how to choose a plan and the date that you have to choose a plan or you're going to be mandatorily assigned. If you look at the very bottom of the page, it says important. If you do not choose, we will place those listed in Step 2 in the MMA plan below, and it will give you a plan name and the plan start date. So this letter the welcome letter is very important because, number 1, it gives you the PIN number, and number 2, it tells you which plan that you will be enrolled in on May 1st if you do not make a selection. So if you're comfortable with this plan, and that's the plan that you want to be in, then you do not have to do anything. The enrollment will be automatic on the day that your region goes live. If, however, you would like to choose a different plan, then please contact us either by phone or go online to make a plan choice. This is a screenshot of our glossary so that you can see the different terms that are used on our website and be able to understand them better. Now, we've also had questions about our auto-assignment process, or how do we select which plans that a recipient would be assigned to if they do not make a choice. We encourage all recipients to make a plan choice. Plan choice is always first. So if a choice is made, then we will honor that and not mandatorily assign someone. So the question is, if a recipient doesn't make a plan choice, how will we determine which MMA plan the recipient will be assigned to? And these are the criteria that we're going to look for. First, we'll see if the recipient is identified as eligible for a specialty plan. If they're living with a chronic condition or disease state, and we can readily see that in our SMMC, or our information system, we'll assign them to the specialty plan if it's available. If not, then we look to see if the recipient has a prior Medicaid Managed Care plan that's also an MMA plan. So if they're in Plan ABC now, and Plan ABC won a bid in their region, then we'll go ahead and assign them to Plan ABC, and then they can call us and make a different choice if they want. We also look to see if the recipient is already enrolled or has asked to be enrolled in a long-term care plan that has a sister MMA plan. So if there's long-term care plan XYZ, and that plan XYZ also is going to be an MMA plan, then we'll look to see if that relationship exists and we'll assign them to Plan XYZ. If none of those factors are available, we'll look to see if the recipient has family members that are already enrolled in or with a pending enrollment to an MMA plan. So we're going to try to keep families together as long as we can see in our system that the family members are connected. So they have to be on the same case, and we'll be able to make that assignment. We also have questions about specialty plans, and specialty plans are, again, for those living with chronic disease or diagnosis. Can recipients choose to be in or identify themselves as eligible for a specialty plan? The answer is yes. If you call and talk to Choice Counseling, then you can inform the Choice Counselor during your choice period that you would like to enroll in a specialty plan if you think you're eligible, or if there's a specialty plan that's available in your region. Now, if you use the IVR mechanism, we would have to already know that you're eligible to be in a specialty plan in order to process the enrollment. So if you think you're eligible but you're not sure, you will need to speak to a Choice Counselor. Now, a specialty plan will be responsible for confirming that the recipient meets the eligibility criteria for the plan. We also get a question about if a recipient qualifies for more than one specialty plan, which one will we assign to? And this is our hierarchy. So the Child Welfare Specialty Plan, and this is for children who are have an open case in the Family SafeNet system or FISFIN. And so if they are eligible for that, they'll be assigned to child welfare before anything else. And then if they have a chronic condition and are eligible to enroll in Children's Medical Services Network, that will be the next hierarchy. We do get questions about if children are eligible for CMS network and they are also eligible for child welfare, we're going to assign them to the child welfare plan. Next on the list is HIV/AIDS, followed by serious mental illness, and then the Freedom Health Plan specialty plans. Now, the Freedom plans are for those adults who are dual eligible and who are enrolled in a Medicare special needs plan and have the diagnosis of diabetes, chronic obstructive pulmonary disease, cardiovascular disease, or congestive heart failure. So those specialty plans are targeted only for adults and for a smaller population. And so for another example, if someone has a serious mental illness and HIV/AIDS, they're going to be assigned to the HIV/AIDS plan. Now, obviously, they have 30 days to make a plan choice and then 90 days after enrollment to make a different plan choice if they desire. Now, our serious mental illness specialty plan is for recipients with serious mental illness like schizoaffective disorder, bipolar disorder, schizophrenia. It is not designed for recipients who may have an acute bout of depression that only lasts for a few weeks. These are for folks who really have a chronic mental illness. Again, it's very important that the mailing addresses are up to date. Almost all of our communication to our recipients is going to be mailed to them. It's going to be in writing, and so it's very, very important. So whenever you as a provider interact with your patient, your client, please make sure that their address information is updated. Encourage them to either call the Access Customer Call Center or to visit the website, the Access Florida website, to be able to update that information. Now, moving forward, we've talked about our choice counseling process and how recipients are either going to be assigned or be able to choose a plan. And so now we're going to talk about continuity of care and how we're going to ensure that continuity of care will happen. And our MMA plans are responsible for the coordination of care for new enrollees that transition into their plan. So the onus is on the plans to make sure that services continue and are not stopped. MMA plans are required to cover any ongoing course of treatment, and that means services that were previously authorized or pre-scheduled prior to the enrollee enrolling in a plan, and these services should continue with the recipient's provider during the 60-day continuity of care period, even if that provider is not enrolled in the plan's network. So this means that for the first 60 days, recipients will be able to see their current provider and receive their services. And so we encourage providers to keep appointments even after the MMA rollout date, because the plans will authorize and will pay for the services in this first 60-day period. Now, there are some services that may extend beyond the continuity of care period, and the MMA plans are responsible for continuing the entire course of treatment with the recipient's current provider, whether they're in the network or not, for prenatal and postpartum care. And postpartum care is defined as the period until 6 weeks after the birth. So during the entire pregnancy, childbirth, and the postpartum period. For transplant services, and that's through the first year post-transplant, the plan must continue to authorize and pay for services for the current providers, even if they are not in network, and for radiation or chemotherapy services for the current round of treatment. So this means that these particular services will go uninterrupted through the entire course of treatment, and any service that is ongoing, like prescription drugs or mental health or physical health services, will continue for the first 60 days with the current provider, and then will be assessed for medical necessity, and then there may be a change in providers. Now, if services were prearranged prior to enrollment with the plan, written documentation includes the following. If there's any prior existing order, so if there's an order on the medical chart or medical record, if there were provider appointments, for example, dental or outpatient surgery or elective surgeries that were already scheduled, that counts as a prearranged or documentation of a prearranged service. Prescriptions, including prescriptions at non-participating pharmacies and behavioral health services. So if you have an appointment, please keep it. If the recipient has a prescription, it will be filled in the first 60 days. And if there's any ongoing behavioral health services or behavioral health services that are scheduled, those will be honored as well. Now, the MMA plan cannot require additional authorization for any ongoing course of treatment. So if a provider contacts the plan to obtain a prior authorization during the 60-day continuity of care period, the MMA plan cannot delay service authorization if written documentation is not available in a timely manner. The plan must approve the service. So services will be authorized in the 60-day continuity of care period. Now, the plan may require the submission of written documentation as described above before paying the claim. So providers will have some responsibility as well as the plan. Again, providers should keep the previously scheduled appointments with recipients during this transition period. Providers will be paid and services will be authorized. Now, we also have provider responsibility during this transition period, this continuity of care period. And service providers should continue providing services to MMA plan enrollees during the 60-day continuity of care period for any service that was previously authorized or pre-scheduled prior to MMA implementation, regardless of whether the provider is participating in the plan's network or not. And providers should notify the enrollee's MMA plan as soon as possible of any prior authorized or ongoing course of treatment, if there's existing orders, if there's prescriptions, or if there's an appointment coming up. Providers need to check the MEV system or the SMMC web portal to verify eligibility and plan enrollment, and this is a responsibility of the provider before providing any service in the current world, and it will be under MMA. And so once you verify what plan, MMA plan or long-term care plan that the recipient is in, the provider should contact the plan to let them know that there is a scheduled appointment or perhaps a prescription or some other course of treatment. And the plans, again, cannot delay authorization, and they must pay for the service. We often are asked, how will providers be paid? And providers will receive payment for services that are provided during the transition. Now, in terms of provider reimbursement, the MMA plans are responsible for the costs of continuing any ongoing course of treatment without regard to whether services are being provided by participating or non-participating providers. So regardless if the provider is in the network or not, the plan is responsible for paying the claim and authorizing the service. Now, the second bullet is a little bit different than what happened in long-term care. So for MMA, the MMA plan must pay non-participating providers, that means providers not in the network, at the rate they receive for services rendered to the enrollee immediately prior to the enrollee transitioning for the first 30 days. So for the first 30 days of the continuity of care period, the plans must pay the provider the rate they were receiving prior to the enrollment in the MMA plan, unless the provider will agree to an alternative rate. Now, providers will need to follow the process established by the managed care plans for getting these claims paid appropriately. And the managed care plans will be reaching out to providers to inform them of the claim submission process and how to receive payment for services. Now, providers may be required to submit written documentation of any prior authorized ongoing care along with their claim in order to receive payment from the plan. So the plans may ask at the time of payment for documentation that the service had been prior authorized. The appointment had been scheduled in advance, or there was a prescription, or there was a prior order. Now, the questions that we get around the agency vendors that have prior authorized services like EQ Health, and do the MMA plans have to honor prior authorizations that were issued either through one of the agency's contracted vendors or from another managed care plan prior to the recipient's enrollment in MMA? And these examples include home health services that have been authorized, dental services, behavioral health, D&D, durable medical equipment, including rent to purchase and ongoing rentals, and prescription drugs. And the answer is yes. If EQ Health is authorized to service or one of the other managed care plans, the MMA plan must continue to pay for any prior approved services during the 60-day continuity of care period. And this is regardless of whether the current provider is in the plan's network or not. Now, during this 60-day period, the plan should be working with the enrollee and their treating practitioner to obtain any information needed to continue authorization after the continuity of care period, if the service is still medically necessary. Some services will continue to be medically necessary and others may not be. After the continuity of care period, if the provider is not part of the plan's network, the enrollee may be required to switch to a participating provider. And we get many questions around pharmacy and prescription drugs. And just some information that we've already put out, but to remind you again, is that for the first year of operation, the MMA plans are required to use the Medicaid Preferred Drug List, or Medicaid PDL, in order to ensure an effective transition of enrollees during implementation. So for the first year of operation until August 31st, 2015, all of the MMA plans have to adopt the agency's preferred drug list. So the drugs that are on the agency's PDL are the ones that the plans have to provide. Now, for the first 60 days after implementation in the region, or during the continuity of care period, the MMA plans or their pharmacy benefit manager, which is also called a PBM, are required to operate open pharmacy networks so that enrollees may continue to receive their prescriptions through their current pharmacy provider until their prescriptions are transferred to an in-network provider. So if your local pharmacy is not in the plan's network, the recipient may have their prescriptions filled at that local pharmacy for the first 60 days. And after that, they may have to transfer their prescriptions to an in-network pharmacy. Now, the MMA plans or their PBM must reimburse non-participating providers at established open network reimbursement rates. And we are working with the plans to share information on the drugs that are on our PDL. We're working with the plans to make sure their systems have edits removed to allow prescriptions to be able to process at our point of sale. For new plan enrollees, and these are members that will enroll after implementation, so maybe somebody is new to Medicaid or changes plans in September after we've completed our rollout, the MMA plan must meet the continuity of care requirement for prescription drugs, but they're not required to use the open pharmacy network. So for new folks coming in after we've implemented, the plans still have to provide the medication and honor the prescriptions, but the recipient may have to use an in-network pharmacy. Now, also during this continuity of care period, the MMA plans are required to educate new enrollees on how to access their prescription drug benefit through their MMA plan provider network. So the plans are required to reach out to all new members and to help them understand how to access services, how to get drugs, and which providers and pharmacies are in their network. Now, we also get a lot of questions around pregnancy. And so if a pregnant Medicaid recipient enrolls in an MMA plan and her OBGYN is not part of the plan's network, does the plan have to continue to pay for these services? And the answer is yes. The MMA plan must continue to pay for these services that are provided by the current provider for the entire course of the pregnancy, and including the completion of the postpartum care, which again is 6 weeks after the birth, regardless of whether or not providers in the plan's network, so that pregnancy care and postpartum care will continue uninterrupted with the current provider. Plans must authorize the service, and they must pay for all of these services. Now, again, we spoke in the beginning of the presentation about our centralized complaint process. So if any of you as providers or any recipients are having issues under MMA or having difficulty with plans, this is the system to use. And so if you look at the top of the page, you'll see the website, and then there's a blue Report a Complaint button, which you click, and when you do that, this screenshot comes up. And so this will allow you to enter your name and contact information, and then allows you to also describe the problem that you're having or the issue that you're having. And this will allow a Medicaid staff person to reach out to you personally and let you know that either the issue has been resolved or reach out to you for more information so we can easily resolve it. Now, we've had several folks ask us if they can submit complaints or issues anonymously, and we are going to allow that, so that you do not have to put in your name or email or phone number. However, if you choose not to do that and you're going to submit anonymously, we ask that you put in as much detail as possible so that we can actually work the issue. If you just put in generalized information, like if you say something like the plan in my region won't pay my bills, there's not much we can do about that unless we can contact you. But if you put in detailed information, then we'll be able to research the issue and resolve it. Now, if there are recipients and or providers who don't want to submit something in writing, or if there are recipients who have trouble with literacy, then they may contact the Medicaid area office and talk to someone on the phone to be able to submit a complaint. And the link to find the 800 numbers, the toll-free numbers for the Medicaid area offices, is at the bottom right-hand corner of the slide, and that's www.mymedicaid-florida.com. So there are two ways to submit a complaint. One is online, and you can just put everything in, and you'll be contacted. And the other is to call the Medicaid area office using the contact information that's at that link. And we encourage you to use this process for payment issues, authorization issues, or just general comments or issues that you may be having. Now, additionally, if you'd like other resources around our statewide Medicaid Managed Care program, you can go to our website, and this is the webpage that will come up. If you have a question, you can email it to us at the email address that's at the first bullet on the left-hand side, which is FL Medicaid Managed Care at ahca.myflorida.com. If you want to receive updates as we post things to our webpage, you click on the red Program Update button, and we will be able to email you automatically whenever we update our website. And that's so that you won't have to go to the website every day or every week to see if there's anything new, that we'll let you know about that information. Now, if you want to participate in other webinars or just look around for other information, use the News and Events tab that's circled in red, and that will provide a drop-down box, and you can see webinars and other information that will be available on our program. Now, additionally, we're using social media to get the word out. So all of our webinars are on YouTube and SlideShare, and you can use those at your leisure. We also are sending out messages via Facebook and Twitter. So there's information that's available on all of these resources, and we encourage you to access them. Okay, I think that concludes our presentation for today.
Thank you for participating in today's presentation, and have a great day.